Hey everyone, welcome to our Northwest Wellness Bring into Health, Pelvic Health, and Physical Therapy discussion. My name is Dr. Herron, and I am a pelvic health physical therapist at Northwest Wellness. Today, we are going to talk about the pelvic girdle, the pelvic floor, and pelvic organs, and all the anatomy related to them. We're also going to review the external genitalia and sexual function for people assigned female at birth. Throughout the discussion, I will touch on the 5 main functions of our pelvic floor. And then towards the end, I'm going to go into how pelvic health physical therapy can help with conditions such as overactive bladder and bladder leakage. My hopes for this presentation. I have 2 main hopes today. One, I would like to bust the myth that Kegels are the solution for every pelvic floor dysfunction. This is important to me because oftentimes so many people assigned female at birth are told by doctors, or they see in a magazine, or they Google, how do I fix this? How do I fix that? And, Kegels comes up. The truth is that Kegels can be very appropriate and helpful at times, and other times they can be the opposite of helpful. So I just want to go into that a little bit. And then I also hope that everyone who watches this will feel a bit more empowered by the end to begin talking about their pelvic health symptoms and consider seeking out a pelvic health physical therapist or other healthcare provider to get some support and help for the symptoms. All right, before we get into talking about overactive bladder and bladder leakage, it's really important to get into the anatomy because that helps us speak the same language. So let's take your focus over to the left side of your screen here. This is a view of the front of the pelvis. So if you and I were standing face to face, this would be the view you have of my pelvis. Up top here, you have the bottom aspect of the lumbar spine. We've got your L3, if you look at my cursor here, L4 and L5. Those sit on top of a pretty cool bone called the sacrum, sometimes called our triangle bone because it makes up a bit of a triangle. I also feel it looks a bit like a slice of pizza, but that may be just me. And then down below that, you have this pink bone, which is formerly called your coccyx, though also commonly referred to as your tailbone. And then out to either side, you have your ilium, which is this fan-shaped hip bone. You've got a couple of them. They come together up front to form the pelvic girdle. This spot right here is your pubic symphysis. That is a common place for people who are pregnant or athletes, specifically gymnasts, runners, lacrosse players, any type of athlete who does a lot of cutting to get pain. That's something, that's a condition that we can treat with pelvic health physical therapy. And then down bottom here, again on the left side of your screen, are your sit bones. And then out to either side, this orange bone is your femur or your thigh bone. If we wanted to find these on ourselves, really quick, what I'll ask you to do is take your hands, place them on the low part of your back, feel kind of press in firmly until you feel kind of this like center bony part. That's your spine. And then go a little bit lower, and you're going to be right in the region of that L4, L5, and a little bit lower than that, you're going to hit that sacrum or that triangle bone. If you bring your hands out to your side, so now we're talking out to this region. Those are your hip bones, okay? And then come to the front, find your belly button. From there, I'm gonna walk you down with your fingers to guide you towards your pubic symphysis. A little heads up here, if you have a full bladder, press gently because we're gonna walk our fingers right over our bladder. And as you walk down, usually you'll go like about this far until you press like an inch or so into you, depending on the size of your body. And then you may feel something a little bit firmer. You will know you're on your pubic symphysis and that bone area when it just has a lot more resistance. It's a lot firmer than the tissues above that. And then if you take your hand and go ahead and sit on it, place it under your right or your left butt cheek, the boniest part there is your sit bone. Okay, next up, let's take a look at the right side of the screen here. So over here is the front of the person. Over here is the back of the person. So up front, we've got that pubic bone, that pubic symphysis where I was just talking about. Back here, the part where it says spine, that's going to be your sacrum with your coccyx and tailbone down at the bottom. And then this pink kind of hammock-like thing represents your pelvic floor muscles. Notice how these are at the bottom of everything going on here. And then we've got three beautiful organs here, three beautiful pelvic organs. Up front, you have your bladder. This kind of string-like line right here is your urethra. That represents the hose where urine or pee exits the bladder. Behind the bladder is your uterus, your cervix. We also have behind that, you'll find your bowel, rectum coming out to exit via the anus. A couple things that I want to highlight here. One is that you can notice how close all these organs are together. It's a real intimate space. This is part of why oftentimes folks who are pregnant get urges to go pee all the time, because as that baby grows and the uterus expands, it can gently press into the bladder. And then also you can notice how close the bowel is to the back of the spine. So for anyone who's ever been constipated and also noticed that you have back pain when you're constipated, this is commonly why, and also because there's a really nice nerve bundle here that hangs out between your sacrum and your bowel. So when you're constipated, meaning you've got some feces building up in the bowel, it can gently press up against that nerve bundle or press up against some other sensitive tissues of your low back. So constipation, low back pain, all conditions that we treat with pelvic health physical therapy, because it's all related in this region here. And then getting into one of the first main functions of your pelvic floor muscles, well, one of their main jobs is supporting all of these organs here. If we have any dysfunction in these muscles, if they're weak, if they don't have the endurance we need, if they don't have the coordination we need, we sometimes see some increased movement of these pelvic organs because they're not being supported as much as they need to. All right, our pelvis is three-dimensional, so I wanted to offer you another view of it. This is the view of the bottom of the pelvis to orient you. So up front here is the front of the person, down here is the back of the person, which means that up here we've got that pubic symphysis joint. Back here is your sacrum coming all the way down to your tailbone. And then out to the side here is one of your sit bones. We've got another sit bone over here. And this is the first photo that really allows us to appreciate the intricacy of our pelvic floor muscles. These muscles here represent the sphincter muscles around our anus, the muscles that help us control when we go poop or when we pass gas. And then these muscles here are some of the ones that support our vaginal opening. And then right here, it's really tiny, so it is hard to see, but that is the little hole where our urethra, again, the hose where our pee exits. All right, another view. This is kind of bird's eye view coming down from the top of someone. I like this view a lot because, again, if we come to the front here, here's your pubic symphysis, okay, the front of the person. Back here is the sacrum region, and then right here, you've got the opening for the anus where poop comes out. Right here, you've got the opening where your vaginal canal sits, and then also the urethra sits. And I like this view because it helps us appreciate one, the pelvic floor muscles, which is, if you follow my cursor, I'll do it a couple times, that's this region here. But it also starts to help us appreciate the muscles that make up the wall of our pelvic region. You know, so if you picture a bowl, and one of those bowls that kind of has like that flat part, and then, you know, the wall that comes around the side, that's a good representation of our pelvic floor. And the muscles that make up the wall of our pelvic region are equally as important as the pelvic floor muscles. A couple muscles I'll talk about later include obturator internus, which is out to the side, and then this piriformis muscle, which is more on the back, and it does attach to that triangle bone. That's a muscle where if you've ever had low back pain and then you've gone to physical therapy and one of your clinicians has used their elbow to gently or maybe not so gently work out some tight muscles in your glute region, a lot of times we're working on that piriformis muscle. And then, okay, so next up, I'm going to go into the three layers of our pelvic floor. My mind was blown when I learned about this. I just kind of, before I specialized, you know, really had this perspective that you just had, you know, just the floor is just one thing. But really, there are three different layers and they all have slightly different functions. So with pelvic health physical therapy, when we do internal exams, I really will look into the function of each layer because it gives us a lot of helpful information and understanding any dysfunction that you're having, and then helping us establish goals so we can work together to overcome that. All right, pelvic floor muscles in layers 1 and 2. So this image on the right side of your screen does a good job representing layer 1 of the pelvic floor. You have, again, down here, you've got the muscles around your anus. And then here, you can see the opening for the vaginal canal. Here, you can see the opening for the urethra. This little yellow bump here represents the clitoris. And then what are the main functions of layers 1 and 2? Well, mostly what they do is they help us control our urine. So urinary continence, helping us control when we go pee, if we can stop going pee when we want to, if we can avoid going pee when we laugh, when we sneeze, when we jump, if we can hold our urine long enough when we get that urge to go pee, but maybe there's a line at the bathroom, or maybe it's COVID-19 and public bathrooms are open. So you really have to be strategic about when you go to the bathroom. Layers 1 and 2 are also significant because they serve as the attachment site for several other muscles. So follow my mouse here. Right over here is the perineal body region. Now, if you have been pregnant before, you may remember your doctors talking about how this is an area that we really want to try to protect as much as we can during vaginal deliveries. This is an area where sometimes people assigned female at birth will experience tearing during a vaginal delivery, or if the fetus life is being threatened, sometimes in extreme conditions, the doctor will have to perform a tiny laceration in this area. And so if that is something that you've experienced, a little tear here or an intentional laceration to help deliver your baby, and you have some scarring here, some pain in this region, or some subsequent difficulty controlling your urine and stuff after the delivery, again, this is stuff we can work on with pelvic health physical therapy. And then one of my favorite muscles, just because it's fun to say, is sciaocavernosus. So there's one right over here. There's one right over here. They call that because it kind of makes this little cave thing going on. Anyways, this is the muscle that when it's functioning optimally, it can help pump blood up to our sex organ, our clitoris, in times of sexual arousal. Layer 3 of the pelvic floor, we sometimes call this the pelvic diaphragm. And this is really the layer that most often gets all the press. A fun fact about this layer is that if we had tails, well, this is the layer where we would find the muscle that would wag our tail. That's that pink muscle here, our coccygeus, as it comes and attaches to our tailbone. Now, what is the significance? What is layer 3 of our pelvic floor do? Well, that's the one that really helps us control fecal incontinence the most. So again, when we go poop or when we pass gas, it's also the layer that does the most work in lifting the pelvic floor and supporting those pelvic organs. It also helps resist increased intra-abdominal pressure. So those are moments when we like cough or we bear down or we sneeze, we get a lot of pressure in our chest region and stuff, and everything kind of pushes down on our pelvic floor, including our organs. So this muscle, this layer, and all the muscles in it also play a role in our continence of pee and of poop. And then this layer has a lot to do with our sexual function too. All right, moving on to our pelvic wall and our piriformis and obturator internus muscle. So if these muscles are tight or painful, they can refer pain to our saddle area, so our genitalia, our low back, our groin muscles and stuff. And they can also make activities such as putting in a tampon, removing a tampon painful, activities such as sexual intercourse painful. So, really assessing these muscles in your own body, if you do experience pain with those activities, can be really helpful in managing that pain and helping resolve some of that pain. The obturator internus muscle, I mentioned this a few minutes ago. This is another one of my favorite muscles. I guess I have a few favorite muscles, but anyways, I like this muscle because it's one of the it just impacts so much. And also it's one of the very few muscles in our body that we can treat externally, so over clothes, and then also internally through the vaginal canal. Kathy Wallace, a big pelvic health guru in the Pacific Northwest, someone who teaches a lot of continuing education courses for people such as myself who want to specialize in pelvic health physical therapy. She shares a story about how one of her patients pointed out to her that when they were having this muscle treated by her, that getting this muscle treated is kind of like washing windows on both sides. So if you picture a window on your house and you want it to be really clean, oftentimes we think about how, well, then it would be beneficial to wash that window on the outside and also use some Windex or some natural product on the inside to clean that too. Well, we can apply this to obturator internus. If we really want this muscle to function optimally and not refer pain to our back, saddle area, genitalia, or make activities such as sexual intercourse painful, well, it can be beneficial to do some soft tissue work or gentle trigger point release to this muscle externally, outside of clothes. But it can also be great to go through the vaginal canal and gently perform some of that soft tissue work in that manner too. Similar to folks who have had jaw pain or TMJ issues, and if you've ever gone to physical therapy, sometimes people will work on that pain from the outside, but also sometimes they'll go in your mouth and work on the muscle that's tender through the inside. Yay! Okay, we finally arrived at the vulva. So let's orient ourselves here. So up top, you've got, this is where your pubic symphysis would be. This is the front of the person. Kind of got the legs, one leg over here, one leg over here. Follow my cursor, we're going to come down to where the sacrum and tailbone would be, the back part of the person. And then we've got the anus right here where poop comes out or gas comes out. Here we've got the introitus, which is the vaginal opening. Just above that, you have the urethra, which again is the hose where pee or urine exits from the bladder. Above that, we have our clitoris. And then out to this side here and this side here, they're not super represented in this image, but you have your labia majora, which are the outer lips that will cover the vulva area. And then beneath that, you have the labia minora, which are the inner lips that cover this part of our genitalia. How do we know the difference between our labia majora and our labia minora? Well, oftentimes the labia majora are the tissues that will have pubic hair over them, and then the labia minora are most often hairless. It's really important, I would like to emphasize here that there's so much beautiful diversity in what the labia majora and labia minora look like on all of us. Some people have a larger labia majora that really covers everything and kind of hides everything. Other people have less tissue that sticks out, so everything like the vagina and the urethra is a little bit more exposed. It's super common, super healthy, super normal to have one that's longer than the other side, just like a lot of us who have one breast that's bigger than the other breast. And then another important thing in this area that I want to draw your attention to is your perineum, which is the skin tissue right over your perineal body. I mentioned this a few slides ago when I was talking about an area that can be injured sometimes during vaginal delivery. It's also, unfortunately, an area that can be injured in folks who have survived sexual assault, rape, abuse of different types. And again, this is just, the muscles under this area, it's like there's this really thick fascia tissue. So it's a strong area that serves as an attachment site for lots of muscles. So this is an area that we talk about a ton in your pelvic health physical therapy because it really sets everything else up to be healthy and to be functioning optimally. All right, let's talk about the clitoris next. So the structure of the clitoris, the anatomy of the clitoris, this is something that I think the majority of people have never realized before. It's usually not covered in that 5th grade or 6th grade really short sex ed class that a lot of us took and a lot of us forgot about because one is a long time ago, and two, because we're surrounded by a bunch of teenagers or soon to be teenagers who giggle every time you mention any of the words clitoris or penis. But what I like about, this analogy here of the clitoris really being an iceberg, I think it helps us appreciate that while so often, whether it's, what you were told growing up or what you were exposed to in school in a sex ed course, what you see on TV, what you read about in magazines, what you read about in books, a lot of times we only focus on the fact that the clitoris is like this tiny little body tissue, towards the front aspect of our vulva. But the truth is, the clitoris is way more than meets the eye. It really expands all the way down on either side of the vaginal canal here and the urethra, just like an iceberg that looks really tiny up top, but goes all the way underneath the water. And then I think this is really important to highlight here when we talk about sexual function. In addition to urinary incontinence, so bladder leakage, or conditions such as overactive bladder, another very common condition I work with clients and patients is people coming in and feeling, or you're reporting that they have sexual dysfunction, having difficulty achieving orgasm, or having difficulty achieving the type of orgasm that they would like to. And, one of the things I found that can be really helpful for people is just understanding the anatomy of the clitoris and understanding that this is all very sensitive tissue. And while oftentimes, whether it's your own hand or your partner's hand or a toy such as a vibrator that you're using to try to stimulate and give yourself pleasure, a lot of the focus can be to this region here, just the top aspect of the clitoris. So I would encourage you, one, to speak with a pelvic health physical therapist if you have any questions about your sexual function, if you have any pain during intercourse, or if you just feel like your sex life is not living up to the sex life that you want it to be. But I also encourage you to explore the sensitivity of other tissues in the area beyond just this top part of the clitoris. A lot of people find that as they start exploring, the vulvar area beyond just this aspect, that it really improves the quality of their sex life. All right, so just touching base, kind of summing up the 5 main functions of the pelvic floor. I've already talked quite a bit about how the pelvic floor muscles and the joints themselves serve as a big support. The main thing they serve as a support for is our pelvic organs, again, the bladder, the uterus, and the rectum. But also it's important to highlight that they offer us stability. And in large part because everything, above the pelvis is stacked on top of it. And so you've got your lumbar spine, your mid back, your neck, your head. If our pelvis and our pelvic floor is not functioning optimally, that can really throw things out of whack going up. And then the other, function is sphincteric. So that's like the closing function. We've talked about our ability to control when we go pee, when we pass gas, or when we poop. Sexual function, a lot of times this comes down to our pelvic floor muscles. Are they, there's like the spectrum. So we have one side over here where our pelvic floor muscles can be extremely tight, and on this other side here, they can be not so tight, they could be a little weaker, they can have a little bit more stretch to them. And either way, that can really impact our sexual function. A couple analogies I like to give for, well, not a couple, one analogy I like to give for the example of our pelvic floor muscles being really tight. It's like if I asked you to grab a tennis ball and squeeze it like really, really tight and hold that there for like 5 minutes, 10 minutes, 20 minutes, and then I asked you to let go of that and try to, write a letter to a friend or something, a lot of people would let go of it, grab their hands, start naturally massaging it a little bit, kind of try to shake it out or something, or they might, grab a pen and have difficulty holding it the way that they normally do. Their handwriting might be a little messier. And that's because when our muscles are super tight and they're in this almost state of perpetual spasm, and then we ask them to do things like help us have sex or support our pelvic floor organs, they're just really not prepared to do that. So, speaking with a pelvic health physical therapist, so you can figure out, where are you at this spectrum? And there's a wide part of the spectrum that's like a healthy range. But if you're on one side too much or the other side too much, that can really start to impact your function. And then, we can go into specifics of why are your pelvic floor muscles a little tighter than we would like them to be? Why are they a little weaker or why than we would like them to be? So things that can be helpful to talk about. And then lastly, sump pump. Well, what does that mean? So Just like our calf muscles, when we walk around, they can help pump blood back up towards our heart and stuff. This is why if you or a loved one has ever been in a hospital and someone tells you to do these like ankle pumps to help prevent blood clots and stuff, well, we've got tissues in our pelvic region that do the same thing. So our pelvic floor is awesome because it supports us. It helps us control when we go pee and poop. It helps us have sex when we want to. It helps stabilize and offer support to our entire spine. And then it helps us promote good blood flow and get nutrients around to the rest of our body. So I think it's pretty awesome. Okay, so just a few minutes left here, folks. We're going to just touch base on overactive bladder and stress incontinence. What is overactive bladder? So that's when we go pee too often during the day or night. It's usually accompanied by a really strong urge to urinate. Sometimes the urge is so strong that we can't make it to the bathroom in time. Well, how do you know if you go pee too often or too little? So let's talk about some healthy norms. So going pee 5 to 8 times daily or every 2 hours is healthy, and going pee 0 to 1 times at night is healthy. So if you can guesstimate right now that you go pee more often than that or less than that, you may benefit from talking about this with a pelvic health physical therapist. It's not uncommon for folks to say that they go pee upwards of 15 times a day. And it can be, that can really impact our social lives, right? If we want to spend time with people, or we have to be in a long car ride for traffic, or again, it's COVID-19 and public restrooms aren't open, finding ways to optimize your pelvic floor health so that you can narrow down how often you go pee, and it's really just in that 5 to 8 times a day, can be really helpful. And if you were thinking that this is just you who's affected by it, I want to draw your attention to the fact that 20 to 40% of people assigned female at birth experience and report symptoms of overactive bladder. Okay, stress incontinence. I've mentioned this a little bit. Stress incontinence is leaking urine during moments of increased intra-abdominal pressure. Again, some examples of this include coughing, sneezing, jumping, and lifting. Common causes of this are pelvic floor muscle weakness. I want to pause here and say, this is, in my experience, this is only the cause maybe a third of the time. And this is where, Kegels gets all the press of saying like Kegels fix everything, because Kegels, refer to pelvic floor contractions. And we know that with any other part of our body, when you do a contraction, if you want your legs to get stronger, maybe you do squats or something like that. So Kegels can help your pelvic floor muscles get stronger. But the truth is that the endurance of our pelvic floor muscles and the coordination of our pelvic floor muscles also really impact our ability to prevent urine from leaking out when we cough, sneeze, jump, and laugh and stuff. And a visual of this would be, let's say you're in a room and there was like a flood happening. I guess it would have to be like a really big flood happening, but water was going to rush into the door of that room. So a lot of, when we look at the power and strength of our pelvic floor muscles, that would be like our ability to close the door on the room and stop the water from coming into the room. So stop, pee from exiting our body, quickly, and be able to go up against the force of that water to stop it. That's strength and power. Now, endurance is our ability to stand there and hold the door closed for 30 seconds until we get to the bathroom, maybe 5 minutes until we get to the bathroom, maybe 30 minutes. And then the coordination is also our ability when it's, you start to get that like tickle in your nose and you're like, shucks, I'm about to sneeze. And you need to close that door to that room really quick because you're in a social situation and you just don't really want to pee your pants. So that's also important. And these are all things that we can assess and talk about together during a pelvic health physical therapy internal exam. And same thing with this condition. This is so common, and it impacts people so much. I've had so many clients say things like, I just have decided that I can't laugh and especially when I'm around people, because I know if I laugh, I'm going to pee my pants, and I, don't want to be smelly, or I don't want to have to go change my pants, or I don't want to have to leave the room. So I just don't let myself laugh. Laughing is so important for our health. We all deserve to be able to laugh, and we all deserve to have bladder control while we're laughing. And, so we see that, 1 out of 4 young adults experience stress incontinence, really common in athletes, 44 to 57% of middle-aged folks, and then 75% of older adults. So I encourage you, if you experience this, to seek out a pelvic health physical therapy to talk about your specific symptoms and what you can try to address these symptoms. Okay, another thing we're just touching on, in addition to, anatomy, pelvic floor function, the muscle function, the joints and stuff. Some other things we talk about in pelvic health physical therapy are, what foods and liquids we're ingesting, because these can really impact our ability to control our urine and stuff. So we refer to these as bladder irritants. Bladder irritants are things that, as we're digesting them and they're exiting our body after they've gone through our kidneys and then down to our bladder, when they sit in our bladder, well, our bladder has this muscle called the detrusor muscle, and some things can sit in there and irritate the lining of our detrusor muscle, and they give us lots more urges to go pee, and they also can impact, how strong that urge is, and therefore impact if we pee our pants sometimes. So a lot of people, are familiar already with how coffee is a bladder irritant. That's why if you drink a cup of coffee, you're like, oh, shoot, I really got to go tinkle like a lot right now. But some other examples include alcohol, carbonated drinks, citrus fruits and juices, artificial sweeteners, milk and milk products, chocolate. Darn, chocolate, yes. And then spicy foods and tomatoes. When I heard that, I thought about how much I love spaghetti and spaghetti sauce. But anyways, just understanding, if we can narrow down if one of these is a bladder irritant for you, because everyone's different, that doesn't mean that you have to cut it out of your diet entirely, but we can discuss some strategies about what you can do when you choose to ingest some of these foods or beverages, so that then you can still have, the life and the social life you want to, and not worry about not being able to control when you go pee. Okay, folks, you made it through. Thank you so much for sticking around this long. I hope this information has been helpful for you. I want to gift you with a couple resources to leave us off here. So Dr. Nell and Dr. Mitchell are two of my favorite pelvic health rehab specialists, and you can follow them very easily on social media. I've put their Instagram names here. They are Vagina Rehab Doctor and My Pelvic Floor Muscles, respectively. I really encourage you to go check them out. I'm certain they have Facebook pages and websites as well if you don't have Instagram. They produce a ton of free content and go into so many nerdy details, but also in an understandable and digestive way, in a fun way and stuff, to talk about our vulvar health, our vaginal health, our sexual health, pelvic organ prolapse, digestion, constipation, so many things. And then I also want to bring your attention to this website, www.pelvicrehab.com. I really encourage you to seek out help and support if you are experiencing any pelvic health symptoms, or even if you're not sure if you are, but you just want to kind of figure out if you are. And pelvic health physical therapy, in my experience, it is oftentimes such an intimate process for most patients. And similar to finding a mental health counselor who is appropriate for you, someone you feel like you can be yourself with, comfortable and honest with, it's really important to find a pelvic health physical therapist who's the right match for you. So if you check out this website, it has it's a great resource because it has the directory of local pelvic health physical therapists. And so you can find the one that's right for you. And then if you are interested in pelvic health physical therapy at Northwest Wellness, you've got our website here. You can email us, info@mynwwellness.com, or give us a phone call. I've got our fax number here if you would like to have a referral faxed over for your doctor for pelvic health physical therapy. And we are offering free consults right now. So if you would like to speak with me and just get some questions answered to better understand if pelvic health physical therapy is appropriate for you, I would be honored to have that conversation with you. All right, folks, that's all for now. I hope you have a great rest of your day. Take care and be well.